Okay, so pregnancy is this amazing journey, right? But let's be real, it can also be pretty confusing. Your body is going through so many changes, and it's not always obvious what's totally normal and what's not. That's exactly why we're here, to talk about the signs your body sends when it needs a little extra help.
And that's the million-dollar question, isn't it? Is this just a weird pregnancy thing, or should I actually be worried? It's something every single expectant parent thinks about. In this explainer, we're going to decode those signals together so you can feel way more confident knowing when your body is just adjusting and when it's asking for you to make a call. All right, let's dive right in with two of the big ones, the ones that can be the most alarming: pain and bleeding. Getting the difference here is absolutely the first step. It is so important to understand this distinction. Little cramping, that can be completely normal. It's often just your body making space for the baby. But when that pain becomes sharp, when it just keeps getting worse or it simply refuses to go away, well, that's your body sending a very different message. So here's the bottom line. Your body is signaling for help. That kind of severe, persistent pain isn't something you just tough out. Nope. It is a crystal clear sign that it's time to pick up the phone and get some professional advice right away.
Now, let's apply that same kind of thinking to bleeding. Some light spotting, especially super early in pregnancy, can be perfectly fine. That's often just implantation bleeding. The warning sign, though, is persistent, bright red blood, especially if it comes along with pain. That is a completely different signal, and it definitely needs attention.
Look, the most important takeaway here is that you don't have to figure this out on your own. Any bleeding during pregnancy is worth a call to your doctor. It is always better to let the professionals figure out what's going on. Okay, next up, let's talk about two symptoms that are so easy to just dismiss: swelling and headaches. I mean, we all get them, but during pregnancy, they can sometimes point to something more serious, like a problem with your blood pressure.
We all get headaches, of course, but the kind of headache we're on the lookout for during pregnancy is different. This isn't your typical run-of-the-mill headache. We're talking about one that is severe, it's persistent, and if you're also feeling dizzy or your vision is getting blurry, that is a major red flag. And this is so critical because that kind of headache can be a sign of high blood pressure or preeclampsia, which needs to be managed really carefully. So if this is what you're experiencing, it's absolutely time to reach out to your provider. And this connects directly to swelling. A little bit of puffiness in your ankles, yeah, that's a normal part of the deal. But what we're looking for here are the keywords sudden and extreme. If you notice swelling that just appears out of nowhere, especially in your face and your hands, that's a sign your body is under some serious stress. Just like with the other signs we've talked about, those keywords are your cue. If it's sudden and it seems extreme, it's time to check in with your healthcare provider. So, we've talked about some pretty clear physical signs. But what if I told you there's one warning sign that gets overlooked more than any other? This next one is actually one of the most direct ways you can check in on how your baby is doing. It is all about your baby's movement. Feeling those little kicks and rolls isn't just a sweet moment, it's a vital sign of their health and well-being. You see, as your pregnancy moves along, you get to know your baby's unique rhythm, their own personal pattern of wiggles and jabs. Tuning into this daily dance is honestly one of the most powerful connections you can have. And the crucial word here is change. If you notice a sudden drop-off in how much they're moving, or if the movements just feel off, that could be your baby's way of telling you they need some attention. And I really want to stress this. The guidance here could not be more clear. Do not wait. Don't try to see if things go back to normal on their own. If you notice a change in your baby's movement pattern, you need to get checked out immediately. Let's finish up by touching on a couple of other important signs that your body might be fighting something off and needs some backup. Okay, two final things to keep on your radar. First, a fever that comes with chills and just won't break. This isn't your average cold. It could be a sign of an infection. And second, we have to talk about morning sickness. Some nausea is normal, but if it gets so severe that you literally cannot keep any food or fluids down, that's a serious problem that can lead to dehydration. In both of these situations, your body is sending a very clear signal that it needs support. This is definitely not the time to try and tough it out. It's time to contact your provider. So after going through all these specific warning signs, I want to end on the most powerful tool you have. And it's not about being scared, it's about feeling empowered. This quote really just gets to the heart of it all, doesn't it? This isn't about creating anxiety. It's about giving you the confidence to be proactive. Choosing to get checked out is never, ever the wrong decision. At the end of the day, you are the world's leading expert on your own body. If something feels off to you, trust that feeling. Never, ever feel bad or silly or ashamed for asking questions, even if you think you're asking a lot of them. That's just you being an incredible advocate for yourself and for your baby. So let's end with this thought. Noticing one of these signs doesn't automatically mean something is wrong. Actually, it means you're doing something incredibly right. You're paying close attention. You're in tune with your body. The only question left is, are you listening to what it's trying to tell you?